Manx Care's total budget for this financial year will be £404.2 million, up from £361.8 million last year. Treasury Minister Chris Thomas says this funding increase means that for the first time since its inception, Manx Care will be funded in line with the recommendations from the 2019 Sir Jonathan Michael report. So, first of all, Mrs. Cope, what's your initial reaction to this budget?
So we very much welcome this budget and this settlement, and we do recognise that this is a 12% uplift on last year, and we know that is beyond the funding formula that takes us back to where Sir Jonathan Michael's report expected us to be. So very much welcome this settlement, very much appreciate the effort the DHSC and Minister Christian has gone to secure this funding for Manx Care. I think when we put this into context, there is recognition that healthcare is incredibly important. And what Minister Christian has, I think, very much demonstrated is the importance placed on being able to fund the mandate appropriately. And I would say that as the chief executive of Manx Care, what we have is a mandate that is properly funded for probably the first time, where we have been able to secure the level of investment needed to deliver everything that we've been asked to do in the mandate. Recognising the mandate is still to be properly debated into more in March. But I think, when we think about health inflation and the true costs of healthcare, what we know is that health inflation was running at over 17% in this financial year. And it is expected to be in excess of 12% in 2026. So that sort of level of funding, that 12% funding uplift, actually matches the level of health inflation, the true costs of delivering healthcare, the true costs of a service which is predominantly based on staff costs. But we also have expensive drugs and consumables, and also the costs of taking patients across to England for the essential tertiary care that they need. So, I do recognise this is a significant investment in health, but very much welcomed by the Manx Care Board.
And aside from this, what this means for Manx Care's ability to try and keep to that budget for next year, what does it mean for patients and staff on the front line over this next year? What will this 12% uplift manifest itself as?
So we have a long-term commitment to really build our out-of-hospital capacity and to support people to remain independent in their own homes, access a good level of out-of-hospital services, and to support people in their own communities. That has been a long-term commitment, and this budget allows us to continue that level of progress. So additional capacity with primary care appointments in terms of dentistry and GP provision, and those practitioners that support delivery in primary care. Support for our carers, that's incredibly important. The ability to maintain our air bridge and our connectivity with England. So the helicopter emergency service is now funded within our baseline. It wasn't funded in our baseline in last year. So for that to be recognised and in our position from the outset of the financial year is incredibly important. We're also able to see an increase in nursing and residential care beds for those patients whose care is funded by Social Security. That will enable us to be able to look at discharging patients from hospital to the appropriate environments sooner. We are also able to move forward with our ambition to deliver NICE approved technology and drugs. And that's something we have been doing year on year. We haven't always been able to fully commit to the full rollout of that. And this year is no different, but it allows us to continue making real progress in treating patients with NICE approved drugs and treatments. It allows us to continue to make investments around safeguarding and in social work capacity, really, really important areas. So we can't do everything. And we submitted lots more business cases, but it allows us to make some real targeted investment on the areas where we know we want to make the greatest impact. And at the moment, that is in the out of hospital services, to be able to build that capacity and to be able to reduce our reliance on hospital-based services.
It feels as though Manx Care is being left now with no excuse to go over budget. The language today is around how health is, as Chris Thomas put it, the real beneficiary of this year's Pink Book. But as we know, there are a lot of costs associated with healthcare. You've just mentioned a few, the cost of drugs, for example. So do you think, despite what's being said, you still could face financial risks over the coming year? What are the biggest challenges that you may face?
So our financial planning going into this year still requires the organisation to make cost improvements of around £12 million. So that's a significant level of cost improvement that the organisation needs to make. We have consistently delivered around £11 million savings for the last couple of years. In fact, Minister quoted that in her speech today. In terms of the level of savings that we have achieved. So demonstrating the productivity and efficiency. So, even with that healthy settlement, the organisation still needs to make £12 million worth of savings. And by this year, over the last 5 years, we will have delivered over £40 million worth of savings. That said, there are some real risks of overspending, and I think that's what Minister Thomas references, and equally Minister Christian has referenced. So some of these are unpredictable and high cost, and you will have heard me speak many times about the cost of safe, compliant healthcare. It's the compliance bar and the safety standards required to deliver comprehensive health and care are the same whether you are delivering for a population of 85,000 or 85 million. The same standards have to be maintained, and we are committed, absolutely committed, to delivering high quality, safe care here on the island. But in terms of some of the sort of financial challenges, we are still at risk from things like high cost individual packages of care. And this is why this is what the £10 million of contingency that was applied into this year's budget has been used for. So £4 million has been spent on high cost individual placements. This is putting individuals in the best possible place for their care, and including individuals who may be transferred out of prison into secure mental health services or other high cost packages. But that has cost us £4 million in this financial year. And that is largely unpredictable cost. It's not anticipated. Sometimes it's directed by other agencies, for example, the Ministry of Justice in a prison transfer. We're also paying for people to have their care topped up where their social security payments do not meet the level of funding or the level of cost of their care. So again, that top up of nursing care for individuals in receipt of social security benefit, again, is a cost of around £1 million. Section 115, when people's care has to continue when they've been detained under the Mental Health Act, is a further 1.5. And these are all the sort of high cost areas which can overspend. It can be unpredictable, and consequently budgets can go overspent. So it isn't risk free, and therefore it does come back to careful financial controls. Careful budget planning going into the year to build in sufficient contingency, and then being able to monitor those costs on an ongoing basis. And that's the role of the Manx Care Board.
So it's a welcome budget, but by no means is the pressure off. It sounds like. And let's talk about that contingency fund there, that £10 million. Because to access this, the Department of Health and Social Care would need to submit specific business cases, which would be subject to Treasury and Council of Ministers approval. Someone described it as being gate-kept by the Treasury now. So is that process going to be a lot more challenging? How do you feel that access to that contingency fund is going to stand up this year compared to other years?
Well, I think this year is the first time we've had a contingency. It has been welcome. We have been very, very clear through terms of reference what is appropriate use of that contingency. And it was put into this year's budget on a non-recurrent basis. But actually, a lot of those elements, like long-term care packages, they aren't a one-year spend. They are often people are in these placements for quite a long time, and those costs go well beyond one year. I think we're yet to see the full detail of how that contingency can be accessed and what the process looks like. Minister Christian has been really clear around how that process will work. So there's a level of agility needed in order to not delay people's care. There's a recognition that if we're requesting this, there needs to be quite a responsive process, which means we get a prompt decision about being able to fund someone's care through that, but appropriate scrutiny and governance, as you would expect when we're spending this level of funding.
Well, one of those members of the Council of Ministers, Chief Minister Alfred Cannon, has said that no one can criticise this administration for not supporting health after this budget. Do you agree with that statement?
I think we recognise that there has been substantial investment in health and care over the last 5 years. The total level of investment has been around 135 million, as Minister quoted in her speech today. That is a significant amount of investment. However, what I would say is Tynwald signed up to the full implementation of the recommendations from the Sir Jonathan Michaels review, which absolutely meant that a substantial amount of improvement was needed across health and care, along with dealing with the growth of healthcare, being able to appropriately fund the level of health inflation we see, the pay awards for our staff. Manx Care is over 75% costs on employees. And just to meet the true costs of healthcare. And like I say, health inflation has been running in the UK at well over 17%. So in order to be able to continue making improvements, to continue responding to growth and demand in our system, and to make the necessary improvements and not to move backwards, it has required more investment. And I think what Minister Christian has really helpfully done is bring that to life in terms of acknowledging and understanding the true costs of healthcare. And I think what we have to do, more importantly than ever into the next year and the next administration, is ensure we are really, really transparent about how health and social care is spending its money, that we can demonstrate we are spending that money wisely, that we are making the right decisions, we are progressing with the right initiatives that the public need to see, and that we are managing our risks accordingly. There are some inherent risks of trying to deliver comprehensive health and social care provision on a small island. And I think the more we openly and transparently talk about that, I think the more the public will start to have the confidence that Manx Care is spending its money wisely.
And I see that Health Minister Claire Christian has said that she's aiming for the Isle of Man to have the best small island health and social care system. Is that your aim as well? Do you see that vision coming to life?
So that has been the vision and ambition of Manx Care for 5 years, and And absolutely, Minister Christian is endorsing that, and which we absolutely welcome. We have seen substantial improvements in the way health and care is delivered on the island. And in fact, there are several examples where we can benchmark ourselves to be much better quality, much better access than other jurisdictions. And I think it's time we probably spoke about that a little bit more, because we can evidence that now. And yes, we absolutely have a very clear ambition to be the best small island health and care system in the world.
And in this next budget, next year's time, there'll be a new administration. So do you feel you'll have to make the most of this year and prove to that next administration why this is the right way forward?
I think we have to constantly prove, as I say, what are the true costs of healthcare? What are the decision points? What do we want as an island? Where are our priorities? And I think we're really clear on that, as are the DHSC. Um, but health and care is complex, and our ambition is that we create the right conversations with the public and with the next administration, so they have a really good understanding of health and care, the complexity and the costs, and what's best practice. And we have a role in Manx Care, of supporting whoever the minister is in terms of those conversations. As I say, we welcome the thought, and the consideration of all of the business cases and submissions that we made into this budget process. And we do acknowledge that 12% is a healthy uplift for health and care. It mirrors inflation, so it allows us to continue delivering against what we have committed to. And as I say, that focus on our out of hospital services primarily to build that community capacity and allow people to access the right care at the right time is really important.
We look at the priorities and what you're hoping to achieve over the next year. Staffing wise, what kind of a challenge does that pose over the next year in light of this budget?
Yeah, so we've had a commitment since Manx Care started to recruit substantively into health and care posts. We know we started with a very high vacancy rate of over 20%, and very high costs of short-term agency staff. So, for example, in 2021-22, we had a substantive vacancy rate of over 20%, and we were spending £13.2 million on premium agency rates. That isn't the best for high quality healthcare. What we want is people who will come to the island, join teams, work as part of a team for a long period of time. So substantive recruitment is really important in health and care. And whilst that means our headcount will have increased, what has happened over the last 5 years is our vacancy rate has reduced by over 10%. And in many of our areas, we are looking at a much lower vacancy rate than that. And that's really important for frontline healthcare workers. We have one of the lowest rates of nursing vacancies that I've seen since the organisation started. And most importantly, from our financial perspective, we have over halved the amount we are spending on premium agency, which is better financially, but it is also much better for the quality of care delivery. So whilst there may be questions around headcount increase, these are roles that are frontline, and we would have to fill those shifts anyway. So much more cost effective to fill those shifts with substantive staff members, rather than premium agency. And we've seen real positive progress there. So again, really important that as an organisation which has predominantly staff-based costs, that we continue to be able to focus on substantive recruitment and retention of our existing staff, and continue to focus on reducing our reliance on highly paid premium agency staff.
Perfect. Thank you very much.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.